very, very bad policy and will really hurt the health of the whole global world.
What's involved in the withdrawal process? How long will it take? Who needs to sign off on that?
Well, the administration has submitted it to the Secretary General of the World Health Organization, and the good news is it will not become effective till July of next year, 2021. We also have to pay our bills for it to really be effective. So we've got a year to turn this around.
How likely is it that the next U.S. administration, if it's not Trump, can and indeed will reverse it?
Vice President Biden, who's a leading Democratic candidate, has already said that should he be elected, he would reverse this on day one.
You mentioned the U.S. needing to pay its bills. There are arrears because there's two types of contributions that the U.S. and most WHO members make. How significant has the U.S.'s back payments been, and what effect has that had on the World Health Organization?
Yeah, in many ways, we're a debtor nation. We owe them money, and it's a real problem because it makes it very difficult for the World Health Organization to do things that you just had on your show, that send people to track the disease that COVID-19, for us to deal with immunization programs, for us to deal with maternal child health programs. They need the money to do that.
You represent an American Health Organization Association. How important is your relationship, or what is your relationship with the WHO?
Well, we have a strong relationship. We're part of the World Federation of Public Health Associations. We're a founding member, which is an official relationship with them. And us as a specific U.S. association is an official relationship with the Pan American Health Organization, which, as you know, is a regional office for WHO. And we work collaboratively with them on a range of issues in our region.
And what would the U.S. departure from the WHO, how would it affect an organization like yours?
Well, let me just say, it would help reduce the prestige and involvement of the United States at the national level. But I can assure you that organizations like mine will continue to work with them as productively as we have in the past.
I want to ask you your opinions as a U.S. doctor about how the World Health Organization handled this first epidemic, then a pandemic.
I'm an emergency doc, and as one of the things I've learned practicing emergency medicine, as nothing goes to the plan. And I think the World Health Organization certainly has learned a lot. We can't say that it was a clear, easy response, but these things are all new. And so anything that they've not done well, we've got lots of time to figure out how we fix those in the future.
And what do you think of this latest effort by the World Health Organization to send a team to probe China's handling, with assistance of China, into the early days of the pandemic?
Well, we have to start doing that. We have to really understand better what the origins are for this disease process. And really, if we understand what happened, we can try to find ways to prevent it in the future. This is not going to be the last pandemic that we're going to see as a species.
The U.S. President has been accused of politicizing this pandemic here in the U.S., and America's top government infectious disease specialist, Anthony Fauci, seems to have taken a different approach lately from the President that has put him in the administration's crosshairs. Your thoughts on what's happening in the last week?
Let me just say, Dr. Fauci, who I've known for many, many, many years, is a good, smart physician. And as long as he's practicing what's in the best interest of his patients, which is the people of America, we're going to stand behind him. And the president's not a doc. I listen to physicians.
Dr. Adhanom from the World Health Organization has said it's still not too late. Health officials need to do what's right. What does the U.S. need to do now, in your opinion?
Well, we really need to provide leadership. Leadership needs to come from the top. They need to have more consistent guidelines. We need to have clear messaging. We have to stop calling everything a hoax. We have to follow the science. And right now what we have are strong non-pharmacological interventions that we can use. Masking, hand washing, and physical distancing. And in many places now we're going to have to reclose our society, return to our homes in order to get our hands around this outbreak. Yes, we can do it, but it's not going to be easy.